Good afternoon. Hope everybody is doing well and staying safe. I'm Dr. Paulami Guha, board, cert- board certified and fellowship trained OBGYN with North Florida Gynecologic Specialist at Baptist Downtown Jacksonville. Actually, I was scheduled to give this presentation sometime in March at JCA. Obviously, with the COVID situation, it was canceled. However, I'm so obliged to the modern technology and Baptist Health and their awesome team to let me do this Facebook Live presentation. To be honest, I speak in conferences and in-person presentation all the time, but this is the first time I'm doing a Facebook Live. Thanks to Baptist Health for that. So, a short background of our practice. Both me and my partner, we are fellowship trained OBGYN and we deal with complex, benign gynecological problems of all age groups, starting from adolescent issues to reproductive and sexual health, menopause, hormone therapy, and any kind of surgical problems also. Today, I'm going to give a brief overview of various perspectives of GYN issues in different age groups, and I'll be happy to take any question at the end of my discussion. Now, women's health is a very vast topic, and it is very difficult to bring it down to a 30-minute talk. However, I'll try my best to highlight the important aspects, and I can always come back for another presentation or hopefully in a in-person talk at JCA when the current situation improves. Okay, so I'm going to start with some aspects of adolescent health and discuss the common problems seen in this age group, and then I'll move on to young women, reproductive age group, and then menopausal issues. So I'll start with a very common issue we see in this age group, sexually transmitted infections. So what are STDs? STDs stand for sexually transmitted disease, which are diseases that are passed from one person to another through sexual contacts. This include chlamydia, gonorrhea, genital herpes, human papilloma virus or HPV virus, syphilis, and HIV. Many of these STDs do not show any symptoms for a long time, but even without symptoms, they can still be very harmful and passed on during sex. So, how are STDs spread? You can get an STD by having vaginal, anal, or oral sex with someone who has an STD. And some STDs, like herpes and HIV, can be spread even without sexual contact, just by skin to skin contact. How common are the STDs? So the STDs are common, especially among young people. There are about 20 million new cases of STDs each year in the United States, and half of this are in the people between the age group 15 to 24. Young people are more prone to STDs because some young people do not get the recommended STD test. Many young people are hesitant to talk openly or honestly with a doctor or a nurse about their sex lives. Some young people have more than one sex partner. So these are the reasons that young people between the 15 to 24-year age group are very prone to STDs. Now, how can I protect myself? The surest way to protect yourself against STDs is not to have any kind of sex. It's okay to say no if you don't want to have sex, but that always doesn't happen. So if you do decide to have sex, you and your partner should get tested for STDs beforehand. Make sure that you and your partner use a condom from the start to finish every time you have oral, anal, or vaginal sex. Practice mutual monogamy, which means that you and your partner both agree to only have sexual contact with each other. Before you have sex, talk with your partner about how you will prevent STDs and pregnancy. If you think you are ready to have sex, you need to be ready to protect yourself. You should also talk to your partner ahead of time about what you will and you will not do sexually. Your partner should always respect your right to say no to anything that doesn't feel right to you. Make sure you get the health care you need. Ask a doctor or a nurse about STD testing and about vaccines against HIV and hepatitis B. When you see a doctor, also discuss about contraception or how to prevent unintended pregnancy and birth control. Avoid mixing alcohol or recreational drug during sex. Okay, so now I move on to, if I get an STD, how will I know? Now, many STDs do not cause any symptoms that you would notice. The only way to know for sure that you have an STD is to get tested. Now, you can get an STD from having sex with someone who also don't have any symptoms just like you, and the person might not even know that he or she has an STD. Where can I get tested? Most gynecologist office will check all sexually active adolescent and young women for STDs. There are also places that will offer teen-friendly, confidential, and free STD testing. So, can STDs be treated? Yes. So, your doctor can prescribe medicine to cure some STDs like chlamydia, gonorrhea. Other STDs like herpes cannot be cured, but you can take medicine to suppress the symptoms. If you are ever treated for an STD, be sure to finish all your medicine. And even if you feel better before you finish it all. Ask the doctor or nurse about testing and treatment for your partner too. What happens if I don't treat an STD? Some curable STDs can be dangerous because if they aren't treated, like for example, chlamydia and gonorrhea can make it difficult or even impossible for a woman to get pregnant, especially if the infection move into your uterus and into your fallopian tubes. You also increase the chances of getting an HIV if you have untreated STDs. Some STDs like HIV can be fatal if left untreated. Some STD like HPV, which is responsible for cervical cancer, if you don't go for routine pap smear screening, there can be cervical precancer, which can change into cancer. Now, what if my partner or I have an incurable STD? So some STDs like herpes and HIV are incurable, but a doctor can prescribe medicine to treat the symptoms. If I have questions, who can answer them? Now, if you have questions, talk to a doctor or other trusted adults. See a gynecologist or expert for expert opinion. Ask which STD test can vaccine they recommend for you. Now, I'm going to talk on contraception for a few minutes. So, what is contraception? Is the deliberate use of artificial methods or techniques to prevent pregnancy as a consequence of sexual intercourse. Voluntary informed choice of contraception and contraceptive counseling is an important contributor to the successful use of contraceptive methods. In choosing the method of contraception, dual protection from the simultaneous risk of HIV and other STDs also should be considered. So although hormonal contraceptive like birth control pill, IUDs, they're highly effective in preventing pregnancy, they do not protect against STDs, including HIV. So consistent and correct use of male latex condoms reduce the risk of HIV infection and other STDs, including chlamydia, gonorrhea, and trichomonas. So unintended pregnancies are pretty common in United States. 45% of all pregnancies are either mistimed, which means the patient did not want to get pregnant at that time, or unwanted, which means the patient never wanted to get pregnant. So proper contraception is a very important aspect in the life of a sexually active woman. It is especially important in adolescent and young women. So contraception can be reversible or irreversible. Irreversible methods include the tubal ligation or permanent sterilization method. This is more pertinent for women who have finished their childbearing. Reversible methods including long-acting reversible contraception, which are specifically recommended especially in young adults. These include IUDs or implants. So IUDs can be hormonal or non-hormonal. The hormonal ones, especially the progesterone IUDs, they're good for 5 years. They're inserted in the office, takes about like 5 minutes for insertion. And I personally always use a numbing block to take away some of the discomfort of insertion. After a few weeks of irregular bleeding and spotting because of the IUD, your period almost completely stop, or you might get 1 day of spotting a month. Nexplanon is another device which goes as an injection in the arm and is good for 3 years. Now, I know there are misconceptions that the IUDs cannot be used in adolescent population or women who have never been pregnant, but there are many evidence-based research which has shown that it is not true. Actually, the American College of OBGYN and the American Academy of Pediatrics, they recommend the long-acting reversible contraception, which is the IUD and the Nexplanon, as the first line of contraception in this age population. The other hormonal methods, of course, which include birth control pill, patches, vaginal ring, shots, like Depo-Provera. This has some failure rates if not taken on a daily basis. The oral combined estrogen progesterone containing pills can also be used to regular heavy periods and treat painful menses in adolescent patients and young women, even if they are not sexually active. Iuds can also be used for similar reason. Other contraceptive methods include condoms, diaphragms, cervical caps with spermicides. However, this has a very high failure rate and should be avoided as the only contraception, especially in young women. Condoms, however, should be used along with other contraception for STD protection. There are also emergency contraception, which can be used after unprotected intercourse within 24 to 72 hours. And copper IUD, which is actually one of the non-hormonal IUDs, can be used up to 5 days of unprotected intercourse as an emergency contraception. Now I'm going to move on to some issues seen in the reproductive age group, and I'm going to start with abnormal bleeding. So what is abnormal bleeding? We call menstrual bleeding abnormal when it's too heavy, which means it's more than 80 ml, which is about 1/3 of a regular cup per period. If it is irregular, so the normal cycle is supposed to come every 21 to 35 days. If it comes more often than that, then it is called irregular. It's called too long if it lasts more than 7 days, or if it occurs after intercourse or in between periods. It is also called abnormal when it occurs after menopause. So why should we do anything about abnormal bleeding? Abnormal bleeding, we women all know, can decrease the quality of life. It's a hindrance to sports, your daily activities, travel, sex, relationships, your body image, and even finances. It can cause pain, fatigue, anemia, and it also increases the chance of endometriosis and endometrial cancer. So how do we evaluate it? Of course, you have to see a specialist, a good gynecologist. We usually start with a good history and physical, pap smear. We order labs, which include labs to look for anemia, PCOS or polycystic ovarian syndrome, thyroid disease, and also look for if you are going into early menopause. Sometimes it includes an endometrial biopsy, which is done in the office, takes about a minute. We usually order an ultrasound to look for fibroids. Also, we do a test to rule out cervical or uterine infection. A pregnancy test is always necessary because a miscarriage can present as an abnormal bleeding. We sometimes do a procedure called hysteroscopy, which is done in the office under local anesthesia. This is kind of like an endoscopy where we use a camera to look inside the uterus. Some causes of abnormal bleeding. So if you're having bleeding in between your normal period, it can be because of an infection, because of a polyp, or hormonal imbalances. Regular heavy periods, which means that you're having the period every 21 to 35 days, but when they're coming, they're very heavy, which means you're bleeding more than 80 ml in that particular cycle. The common causes are fibroids, adenomyosis, bleeding disorders. We see the bleeding disorder mostly in adolescent patients when they have heavy periods, and also uterine infections. Irregular uterine bleeding can be heavy or light. Heavy, irregular, prolonged bleeding with no pattern are often following a long delay in an expected period. This can happen in patients who are not ovulating, which happens in like perimenopausal period, which is just before menopause, and also like in patients with PCOS, with hormonal imbalances, thyroid dysfunction, and also abnormal prolactin level. Prolactin is another hormone which can cause abnormal period because of anovulation or lack of ovulation. Bleeding after sex can be from abnormal pap smears, cervical precancer, even cervical cancers, cervical polyps, vaginitis, and sometimes postmenopausal vaginal dryness. I'm going to talk in brief about fibroids because I and my partner, we also run a fibroid clinic. So fibroid are benign tumors of uterine muscle cells. They're very common. One-third of reproductive age women have fibroids, and 70 to 80% of women will have some form of fibroids by age 50. They are responsive to estrogen and progesterone, so they stop growing after menopause when the ovary shuts down and we stop secreting the estrogen and progesterone hormone. Symptomatic fibroids are associated with heavy periods, pressure, pain, pregnancy complication. It's actually the most common reason for hysterectomy in United States. It's usually diagnosed by an exam or an ultrasound. They can be taken care of by removal of just the fibroid or removal of the uterus as a whole, as like a hysterectomy, in case the patient has completed her childbearing. In our practice, we do these cases laparoscopically with very tiny incisions in the abdomen, so our patients have a very fast recovery and they're able to go home the same day. So depending on the cause, age group, and after thorough evaluation, other types of heavy, irregular bleeding can be treated with Iuds, birth control pill, or endometrial ablation surgery. Now I'm going to talk a little bit on endometriosis. This is another big problem we see, which can affect young women and older women in the reproductive age group, and sometimes even in menopausal women. Endometriosis is a painful disorder in which the lining of the uterus, which is supposed to stay inside the uterus, that can spill through the fallopian tube, or there are other theories how it can happen. And there can be deposits on the ovaries, fallopian tubes, and the tissues lining of the pelvis. It can cause pain, sometimes very severe, affecting your quality of life. And the pain usually starts like a week before your period, and sometimes patients will complain of like a chronic pain throughout the month, but the pain is usually more severe during your menstrual period. Endometriosis can cause fertility issues also. However, fortunately, there are effective medical and surgical treatments which are available, and our practice specializes in treating endometriosis both medically and surgically with a minimally invasive approach. Now I'm going to talk a little bit on menopausal issues. So what is menopause? So it's a time in a woman's life when she stops having monthly periods completely. The ovaries stop releasing eggs and stop making hormones, which include the estrogen and progesterone. So the average age of menopause is about 51 among the Caucasian population. However, 95% of women will go into menopause between 45 and 55 years of age. Symptoms include hot flashes, night sweats, sleep problems, vaginal dryness, depression, joint pain, body ache, trouble concentrating or remembering things, and also sexual issues. These symptoms can occur in 75 to 80% of menopausal women, often starting during perimenopause. However, only 20 to 30% women usually seek medical advice. Hot flashes may last up to 7 to 8 years, with symptoms persisting 4 to 5 years after menopause. So actually, those hot flashes, those symptoms can start before you actually stop your period. There are many non-medical remedies which are of limited effectiveness. This include, of course, like cooling your core body temperature with exercises, relaxing activities like yoga, massage, meditation. Avoid triggers like spicy food, hot drinks, caffeine, alcohol. There are also many over-the-counter medicines like which we call natural, but make sure they don't interact with any of your medication which you already take for your blood pressure or diabetes, because just because they're natural doesn't mean they're always safe. And usually these medications are not FDA approved and they are not evidence-based. Some of the common ones include black cohosh, red clover, soy, flaxseed, donquay, wild yam, ginseng, and evening primrose oil. These are, as I said, are of limited efficacy and not FDA regulated. If there are no contraindication, the best way to manage these symptoms are with hormones which include estrogen and progesterone. However, there's some contraindication which includes previous history of stroke, blood clots, breast or uterine cancer, which are contraindication to any kind of hormone therapy. So for these group of patients, there are non-hormonal FDA approved therapies which helps to a certain extent. Some vaginal symptoms of menopause includes vaginal itching, burning, painful sex, light bleeding after sex, increased frequency of urination. These are due to low estrogen level, which causes loss of collagen in the vagina. However, vaginitis or infection may also happen, which needs to be ruled out also. And the best way to treat this is with vaginal estrogen, which comes in various forms, including creams and suppositories. And there are enough research to show that just using vaginal estrogen does not increase the risk of breast cancer. So even if you're using systemic estrogen for hot flashes, in 40% of cases, the estrogen does not reach the vaginal tissue. So we usually start the treatment with use of lubricants and moisturizers. However, the best way to treat this is vaginal estrogen, which takes some time, about like 4 to 6 weeks, but that's the best way to treat it because it helps in the formation of collagen. There are certain chronic vulvar skin conditions which might also cause painful sex and difficult urination. It includes vulvar disorders called lichen sclerosis or lichen planus, which are usually confirmed with a vulvar biopsy and treated with steroid creams. Our practice also specializes in this kind of treatment. Other menopausal issues include postmenopausal bleeding, which might be from atrophic changes of the uterine lining, which is actually the commonest cause. However, they can be from uterine polyps, cervical polyps, dry vagina, and the bleeding is usually after sexual intercourse. It can also be from cervical precancers or uterine cancer or uterine precancer. So whatever the causes may be, any kind of postmenopausal bleeding should always be evaluated with either an ultrasound or an endometrial biopsy. These are the endometrial biopsy, as I said earlier, is a very short procedure, doesn't take even a minute, and is usually a little bit uncomfortable, but as I said, we usually do it with a block, so it doesn't bother the patient that much. And as I said, it's a very simple procedure, and we do it with local anesthesia. So other menopausal problems include urinary incontinence, which might be due to overactive bladder or from weakening of the muscles supporting the bladder urethra. Both these conditions are easily treatable, so talk with your gynecologist regarding this. Another pertinent problem which I want to discuss very briefly is osteoporosis, which affects 45% of menopausal women and is actually a silent disease which makes your bone brittle, and you won't realize it until it causes fractures of the wrist, spine, or hip from minor falls, or even pain or deformity in the back due to osteoporosis of the spine. Routine screening with bone density starts at age 65. However, in high-risk population, we can start it even earlier. Weight-bearing exercises with vitamin D and calcium are always useful to prevent it. Now, I want to throw some light on decreased sexual desire, which commonly affects menopausal women, but we see it also in young women too. One of the term we use to describe it, we call it hypoactive sexual desire disorder. So it is defined as the absence of sexual fantasies and thoughts and or desires for or receptivity to sexual activity that causes personal distress or difficulties in a relationship. It's a huge topic to discuss in this small amount of time, but there are therapies and FDA approved medicines to help depending on the cause. So seek help if you think you're distressed because of HSDD or hypoactive sexual desire disorder. I'm going to talk on women and cancer for a few minutes now. So most cancers takes years to develop. Many things can affect your chances of getting cancer. Things that raises your chances of getting cancer are called risk factors. You can't control some risk. You cannot control some risk factors like getting older, but you can control many others. In fact, there are things you can do every day to avoid getting cancer. Two of the most important things you can do as making healthy choices and getting the screening tests that are right for you. Some of the risk factors you can avoid are ultraviolet rays from the sun or artificial sources like a tanning bed, a booth, or a sun lamp, which can cause skin cancer. And actually, it's the most common cancer, and it is usually because of the harmful ultraviolet rays from the sun. So I know, like, being exposed to the sun helps in the formation of vitamin D, which helps to prevent osteoporosis. But you have to remember, at the same time, it can cause other bad effects like skin cancer. Drinking alcohol raises your chances of getting at least 6 kinds of cancer, including breast cancer and colorectal cancer. About 40% of all cancers are associated with overweight and obesity, which is a big problem in our country now. Screening tests can find breast, cervical, and colorectal cancers early when treatment works best. Lung cancer screening is also recommended for some people who are at high risk. So we usually follow ACOG recommendation for ordering our screening test. We recommend starting mammogram at age 40. Sometimes if you have family history of breast cancer or you're at high risk of breast cancer, we might start it earlier. And if you have a high risk of breast cancer, we might alternate the mammogram with breast MRI to detect cancer early. Cervical cancer screening, we start at age 21. And depending on your risk factors, or depending on whether you're sexually active or not, or whether you have a history of abnormal pap smear before, we do it every 3 to 5 years along with HPV screening. We recommend starting colonoscopy now at age 45. It was actually age 50 before. However, if you don't have a family history and if you're low risk, sometimes we can delay the colonoscopy till age 50. Now, I've seen patients, when I talk about colonoscopy, their facial expression changes because it's a lot of preparation you have to get, and the patient has to be put under a light sedation. But believe me, it's one of the best tests to detect colon cancer, because they can easily remove precancer, polyps, or anything when they see it during the colonoscopy. Now, there's something called Cologuard now, which is like a stool test. That's also pretty sensitive. However, if you have a family history of colon cancer, or if it comes back abnormal, you have to go back and do a colonoscopy. The colonoscopy, if everything comes back normal, if you don't have a family history, is usually repeated every 10 years. So in brief, this was all I can cover on women's health. I will be happy to go back at JCA in the future to talk more. Hopefully the situation we are going through improves soon. Hopefully, we get a vaccine soon, so that we are able to communicate and go around and give speeches like just we used to do before. Thank you so much for having me. Now I'm going to check whether if there's any question which I can answer now. I think I've only like a couple of minutes, but I will be happy to take any question if you guys have any. If you guys don't have any questions now, I'll be happy to answer them. I know Ms. Newell, she told me that this is going to be recorded and be on the page. So if any questions come up, I'll be happy to check back later and answer them accordingly. Thank you so much. Everyone stay safe. Again, this was Dr. Paulami Guha from North Florida Gynecologic Specialist at Baptist Downtown Jacksonville. Thank you so much for bearing with my Facebook Live presentation. Bye-bye.